Hi, you're watching CBSN Denver. I'm Jim Beneman. As the Delta variant continues to spread in Colorado, we know you probably have more questions on how you can protect yourself. That's why we have asked medical editor Dr. Dave Hnida to join us to get those questions answered. Dr. Dave, we know the Biden administration announcing everyone who got the vaccine will need the booster shot. We're still waiting for sure on those who got the J&J vaccine, but people getting their third shot. And is there anyone who should be getting it already and not before September?
I think the most important thing to talk about with these booster shots is why are we doing that? I think first thing to really take a look at is the fact that we know that the vaccine right now is extremely effective as is at preventing the development of severe disease, hospitalization, and death. But what we are seeing is that at about 6 to 8 months out, you begin to have a little waning of immune protection. And so you become more prone to mild or moderate disease. In other words, you feel like you have a cold, you have some sickness, or even you're in bed for a week. And those are the things that we're trying to really go after by having this booster shot. Now, who should be getting a booster shot right now? Kind of taking a look at people who are immune system compromised, people who take medication in order to suppress their immune system, people who are undergoing cancer therapies, people who have had organ transplants and so forth. They're first in line in order to get the third shot beginning right now. Then when you take a look at where we're going as we go into September, I think as we hit the middle of the month, we'll see folks who are about 8 months out, and those people would be healthcare workers, nursing home residents, older people would begin to get in line for their third booster vaccine. And then thereafter, you know, it's going to be pretty much like we had with the original go-round. We will begin to see everyone else literally get in line and get their vaccination taken care of, that third booster at about their 8-month mark out from the original vaccination series.
You know, Dave, I don't think through all of this, the entire pandemic, we've seen quite the emotional and at times hostile debate among parents and school districts in terms of masking the youngest kids at this point. We're seeing that now. Are you worried, Dave, that when we get into September and the kids have been back to school for a while, do you worry about a real spike in cases in America's school children?
No question about it. I think everyone is very nervous about this at this point in time. And really, there's two reasons for this at this point. The first is this Delta variant. I mean, it's a vicious variant. It is super contagious. And then you take a look at the number of unvaccinated adults who really are driving infections. And so we really do worry about, you know, what is going to happen to those who cannot be vaccinated, particularly those younger children. And so they will be at risk, not just for getting ill, but also spreading illness at home and to others. And so we really do worry about that. And it is a situation where, you know, we don't worry that much about adults who have been vaccinated. They are having breakthrough infections at, you know, a low rate, but we do know that the vaccine is protective, but nonetheless, we'd like them to mask up. As for people who have not been vaccinated, we really want them to mask up. And that would include, obviously, young kids. And so protecting the kids really should be the reason why you should not hesitate to wear a mask if we are really advised to do so. And in terms of masking in schools, it's smart. We need to take that into account when we are looking at protection.
So that's masking in the schools. And Dave, also the CDC, we know, recommending even those of us who are vaccinated go back to wearing a mask indoors. We're out in public. You would concur with that guidance, I take it?
I think at this point in time, I really agree that people who are vaccinated really should be masking in indoor settings, because we know that masks are protective, and we know that indoor settings are how the infection is spread most quickly. So we're really, you know, there's no question that masking really needs to take place. And I think, unfortunately, it should be mandated, because let's look at it, just the honor system really didn't work. And so I think we are going to have to really take a look at some mask mandates to protect our entire population and get things to cool down. Our hospitals are being overrun right now and, you know, at a bursting point. And so people with other illnesses and diseases, they can't be cared for properly.
Yeah, Dave, let me ask you, you know, a lot of the people who live in Colorado and many western states are saying, I'm coughing, I'm sneezing, but there's wildfire smoke. Is it the smoke? Might it be COVID? Is it allergies? How can people maybe self-diagnose as to exactly what it is they're suffering from?
Boy, self-diagnosis is really a difficult thing in this particular situation. My gosh, you take a look at really when it comes to things like irritation from smoke, when you take a look at allergies, when you take a look at upper respiratory infections and respiratory viruses, which are starting to go around again, sometimes it's really hard to tell the difference between COVID and other things that are going on. And so I think that really one thing to look at is that COVID can cause everything and anything, whether it be a runny nose, congestion, diarrhea, sore throat, headache, not necessarily a high fever, not necessarily a severe cough. It can be anything. It masquerades as anything. So if you are ill, if you don't feel well, I think you need to stay at home. Your kid needs to stay at home. And by all means, consider COVID testing as just a precautionary sort of move. I think it's a wise idea. In my world these days, everything is COVID unless we prove it is not.
Dave, final question, and the potential worst-case scenario. Let's say 30% of Americans continue to insist that they are not interested, they're not going to get vaccinated. We've got the Delta variant. Perhaps there are more variants after that. Will we ever truly get a handle on this pandemic?
I think at some point we will, but let's face it, we all were expecting great things come this summer, and it didn't happen. And you need to understand that viruses continue to mutate. We always look back at that Spanish flu virus of 1918. You know that virus is still around. It has mutated hundreds and hundreds and hundreds of times. And so it is at a point where we really expect that COVID will become part of our natural sort of viral, bacterial, infectious population that we live within. And so each year we may be getting booster shots, perhaps not, but it is going to be something that is going to be a forever with us illness.
All right, Dave, thank you. And really, honestly, on behalf of all of us here and our viewers, our listeners who are going to be watching CBSN Denver, thanks so much. Your medical expertise has been truly a blessing in helping us navigate through this crisis, and we appreciate it, Dave. Thanks again. And you take care of yourself. You're on the front line. We need you to stay healthy. All right, Dave Hnida, thank you. And to find the latest coronavirus headlines and information, just head to CBSDenver.com.